And the 81st annual Sturgis Motorcycle Rally is officially underway in South Dakota. The event is expected to draw up to 500,000 bikers to the area, raising concerns of a surge in cases as the Delta variant continues to spread across the country. CBS News correspondent Mola Lenghi reports.
You're a biker and you cannot make it down here to Sturgis in your lifetime. You have missed out.
What do they say? There's two kinds of bikers. They're the ones that are already here and the ones that are on their way.
That's it. This is the Mecca, man.
So proudly we hail.
Mecca or not, the 2021 Sturgis 10-day bike rally got underway yesterday. Ceremoniously, no mask mandates, no proof of vaccinations needed.
But we're not going to start checking papers. I mean, that's not really an American way.
Daniel Ainsley is the city manager of Sturgis, population 7,000.
Considering the pandemic, what considerations were in mind?
Yeah, no, that's one of the reasons we're looking at an open container.
This year, people can drink on the streets to avoid crowded bars.
Does the COVID thing worry you at all?
No.
No.
I haven't been worried about it at all. Not since day one.
Vaccinated, not vaccinated?
Nope. Not vaccinated, not getting vaccinated.
And not getting vaccinated.
Nope.
All right.
The big gatherings, along with county and state fairs, comes as schools are set to reopen. In a few places, parents who are against masks are taking a stand. Yet COVID cases in children are rising. More than 71,000 reported last week. 8 states have banned districts from requiring masks in schools. Yesterday, a judge in Arkansas ruled the ban cannot be enforced. But Illinois and New Jersey became the latest states to mandate masks for K-12 students.
I have to ask, why wouldn't we send our kids to school with a mask on?
Louisiana's governor has good reason to want masks. The state is ranking #1 in the new Delta-driven COVID surge.
We're the #1 state. That's not a distinction we want to have. And quite frankly, it's not even close. The #2 state is Florida.
In Fontana, California, high-tech temperature readers are rapidly checking 2,200 students a day at the high school where Cassandra Hernandez is a senior.
I saw other people getting vaccinated, so I was like, you know what, maybe it's a good idea, especially since we're going back to school.
United Airlines officials announced yesterday vaccines are mandatory for its employees to work indoors or on board. And in the San Francisco Bay Area, according to a survey just released, 43% of companies are mandating employees be vaccinated.
Now, this rally provides a huge economic boom for the state, the region, and this town. There are health considerations when putting on this rally, but right now the vaccination rate in the state is right around the national average, and there are currently only 13 COVID-related hospitalizations. So, Bradley, as you can imagine, health officials are encouraged by those numbers.
Lenghi, thank you. Louisiana is one of the hardest hit states in this summer COVID surge. For more from there, I'm joined by Dr. Mark Kline. He is the physician-in-chief at Children's Hospital in New Orleans. And Dr. Kline, before we talk about what's going on in your state, I want to ask about events like the Sturgis Rally in South Dakota. With the rapid spread of the Delta variant, do you think that these large gatherings could become super spreader events, even for people who are vaccinated?
Absolutely, Bradley. We've seen this movie before. There have been multiple super spreader events over the course of the pandemic. The difference today is that we're dealing with a version of the organism, this new Delta variant, that is even more contagious than the one we dealt with initially. It's twice as likely to spread person to person. And so the average person infected with the Delta variant may transmit the virus to 5 or 6 or 7 or 8 people in the absence of any masks or other mitigation practices, whereas the original variant maybe only to 2 or 3 people. So we've seen this a number of times, most recently Provincetown, Massachusetts, after a July 4th gathering. I think more than 1,000 people have been infected as a consequence of that. So there's no doubt whatsoever that these kinds of events are dangerous and are likely to turn into super spreader events.
And Doctor, down in Louisiana now, you lead the nation in the case rate, averaging 4,300 cases a day. Let's listen to a little sound from the top medical official at the State Department of Health about how that is affecting hospitals.
50 hospitals have reached out and said they do not believe they can adequately meet their community's needs with the amount of sick people coming into their doors right now.
Dr. Kline, I know you're seeing that surge too. I understand there are a lot of patients in their 20s and 30s that are coming into hospitals. Are the people who are winding up needing treatment largely unvaccinated?
They are. About 90% of the patients that are hospitalized today across the state of Louisiana are unvaccinated. This is a pandemic of unvaccinated people, and so there are some breakthrough cases among the vaccinated, but those tend to be very mild. They typically do not produce hospitalization and deaths. And we're just dealing with a different animal now than we did a year ago. This new variant is not only more contagious, it's more virulent. It's impacting young people and children in a way that the original version of the virus did not. And hospitals across the state of Louisiana and a number of the adjoining states are just inundated to the point where we're really concerned that we won't be able to provide care to others who need us.
And Doctor, I want you to talk a little more about the medical differences you're seeing with this virus. You, of course, specialize in pediatrics, and I think there is still this widespread idea that the virus spares children in some way. But what are you seeing with the Delta variant?
Yeah, I would say through most of 2020, Bradley, the word was out that children were hardly ever infected with the virus. They wouldn't transmit to others. If they did become infected, they would only have mild symptoms. But we're seeing now a rapid uptick in the number of cases among children. I can just tell you here at Children's Hospital New Orleans, 30 days ago, the positivity rate for COVID tests done on children in the outpatient setting was just 1%. 2 weeks ago, it had risen to 7%, and today it's more than 15%. So that gives you some idea of the amount of transmission that's occurring in the community. And then we're seeing lots of kids admitted to the hospital. We have 13 in the hospital today with COVID. Most of those are under 12 years of age. 6 of the 13, in fact, are under 2 years of age. I don't think that's the image most people have in their heads of what COVID is for children and adolescents. And we have 2 children under 2 years of age in the intensive care unit today who are seriously or critically ill. So this variant, this Delta variant of the virus, is really wreaking havoc in terms of the numbers, but also the severity of cases. And we haven't seen any indication that it has begun to plateau. I think we're going to have a rough number of weeks ahead.
Doctor, it's so hard to hear about those kids, and particularly the kids that are not eligible to get the vaccine. I mean, right now, only children aged 12 to 17 can get it. You must be so eager to be able to get kids younger than that vaccinated. When do you think it might be approved?
Yeah, absolutely. That's such an important point to make. The only group nationally that is 100% unvaccinated is children under the age of 12 years. They haven't been eligible for a vaccine. The studies, of course, are underway. And I hope that we will see a vaccine with at least emergency use authorization from the FDA by the end of the calendar year. But it remains to be seen. The manufacturers have to present the data to the FDA, and then the FDA has to make a judgment on that. But we're desperate for a vaccine in younger children. I know parents are asking about it. It's one of the top questions that I get from parents, and we're eager. In the meantime, we can help to protect those young children by surrounding them with vaccinated adults and adolescents. So if it's an adolescent 12 years of age or older, or certainly an adult who is eligible for the vaccine, this is the time to be vaccinated, and let's protect ourselves and our communities, but let's also protect those young children who are too young to get a vaccine just yet.
Another reason for those holdouts to get the shot, but officials are also looking at different ways to encourage them that are a little bit more, a little stronger. Earlier this week, New York City announced it would require proof of vaccination for indoor activities. And where you are in Louisiana, the governor put a universal mask mandate back in place. Do you think that these more aggressive measures are helping?
Well, time will tell, Bradley. I don't know that we have enough data to know exactly how this will turn out today, but I'm all for mask mandates. I think sending children back to school without a mask mandate, just saying, you can wear a mask if you want to, or even worse, we're going to ban masks in schools, that's a formula for disaster. Predictably, there will be clusters of cases in the schools. Those kids will bring home the virus to their parents and their grandparents. That's a disaster in the making. So I'm all for mask mandates. I'm all for continuing of social distancing and good hand washing. And we've got to do everything we can to convince those holdouts to get vaccines. Our way out of this is through vaccination. Masks will help. In the meantime, masks do work. But long term, the way to avoid these surges and to avoid another surge in the future that could be even worse than Delta is through vaccination of large numbers of people in our population. We still have way too many adults and adolescents who are eligible for vaccination but who have not received the vaccine.
Such a good point, Doctor. Dr. Mark Kline at Children's Hospital New Orleans, thank you.
Thanks for having me.